Yeah, so the digitalisation project has had a massive positive impact on the department for patient safety, also for the staff and their time management. So key aspects are that they've been able to look at real-time data so that it real-time stamps dates and accountability for who's done each action, and instead of writing about stuff which happened retrospectively, we're able to put it real time. And also from a tracking point of view, for other people looking in the department and especially the nurses in charge, they're able to see what's happening with the patient rather than spending time going to look at handwritten records, trying to locate handwritten records, maybe misfiling or misscanning of records to different people's, or potentially those who are transferred to the mainland, for example, their notes may go with them, and then we no longer have a record of what we did for that patient here. The benefit of that is that also then we can go back and audit these aspects, which obviously gives outcomes to improve patient care.
The transformation had to be at every level. Understanding what was delaying the patient's pathway was important to us as well. We had a system already in place called Symphony, which is an electronic system that we work here with in A&E, but obviously a lot of A&Es use the same system. It's basically a tracking, an electronic tracking, where the clinicians could type their notes. The system had the ability to actually incorporate the nursing notes as well. So what we did was working with the digitalisation group and the information system in developing the parts of this paper chart that should be integrated into the electronic system. This has allowed us to actually understand the patient pathway a lot better. So instead of a patient coming in and we entering data retrospectively, we are now using an electronic system that is done in real time. When a patient comes to the department, if we have a diagnostic or an investigation, that is entered in the electronic system there and then. So if a patient is ready to leave the emergency department, all we need to do is 2 clicks in the system, rather than the very long previous way of working that would require you to enter all the data retrospectively that was entered in a piece of paper. So the digitalization didn't only allow us to save time on the data that is entered in the system, but the time that this process has brought to the department is actually that we release more time to actually be with the patients and delivering the care. We also have a process that we can track the patients now. So the nurse that is in charge with the Epic, they are able to see in a real time what is missing in that pathway. So instead of having to go to the bedside and look at the notes, the electronic system from wherever they are able to tell them where the patient is in their pathway in their journey in the emergency department.
Yeah, so because we've had so much great success on the digitalisation in the emergency department, we're able to look at other ways of expanding that. And I think because we've got proven experience and good analytical data to showcase the benefits of it, we can introduce it to other areas across the emergency floor and bring other departments in and show them the success we've had, which will undoubtedly benefit them.
So by moving to the digitalization of the nursing documentation onto Symphony has improved our care, and the risks associated to that has decreased. So the documentation is always there, it goes with the patient and is accessible at any point after the patient's journey.